I'm Madalyn Thomas, and I'm going to be talking about effective communication in the radiology department. Can you imagine going in for a Doppler sonogram of your right lower extremity and then passing away the next day? A death that resulted from a pulmonary embolism due to the radiologist's failure to communicate the sonogram results. Sadly, this is an actual case that happened to a lady in Virginia. After graduating East Central, I plan on applying to a diagnostic medical sonography program to become an ultrasound tech. Ultrasound is the use of sound waves to detect an image. Most people know sonograms from a baby ultrasound, but they can also be done from any body part, like the heart and kidneys. Communication is a vital role in the radiology department. In this presentation, I will describe the importance of communication between patients, radiologists, and physicians. Most patients going into an ultrasound is expecting the worst possible outcome. As an ultrasound tech, you are there for the patients during the whole scan. Like UKessays.com said, since ultrasound scanning is carried out in a real-time examination, patients may be able to interpret for themselves the nonverbal cues and body language of the sonographer during the scan. Ultrasound techs must be aware of all nonverbal cues and body language, as it may make the patient's anxiety increase. You want to make the experience the most comfortable you can, as it can be a very nerve-wracking scan. Ultrasound techs are just trained to scan a useful image and deliver it to the radiologist. The radiologist is the ones who actually interpret the image and deliver the results to the patient and their physician. So, as an ultrasound tech, you must only do the job you are trained to do: scan the image and deliver it to the radiologist. We depend on the radiologist to do their job in communicating with patients and physicians. There is a variety of different ways to communicate sonogram results. With technology growing, communication can be done a lot faster in the medical field. At Mercy Hospital, we use a system called Epic. In the system, they can store patient information, chart patient information, and most importantly, communicate orders and results. Although nonverbal communication is more effective, in some cases, verbal communication is better. It's only one phone call away to tell the physician the results. In the radiology department, the most effective way is to use both verbal and nonverbal communication to make sure the information is passed along. In fact, according to Leonard Berlin, the judicial system seems to be expanding the radiologist's duty to directly communicate the results to patients and their physicians. This way, failure to communicate becomes less of an issue. With all the different ways to deliver sonogram results, you would think it would only happen a couple times. Unfortunately, failure to communicate happens often. According to medical malpractice insurance companies, data shows that the second most common cause of medical malpractice litigations in the U.S. is failure to communicate results of radiologic examinations. I currently work as a patient care tech at Mercy Hospital, and I understand how easily you can become busy and distracted, but this number is exceptionally high. With the variety of ways to communicate information, there should be no reason a radiologist can set time out to deliver the results. The majority of patients getting an ultrasound is there to ensure everything is fine. If there is something wrong and the radiologist did not communicate the information, then the physician cannot treat the problem. Failure to deliver radiologic results can result in horrific events like the lady in Virginia. Communication is a vital role in the health field, but extremely important in the radiology department. As an ultrasound tech, we can ensure that communication is delivered to the patient in a positive way, and we should be aware of all nonverbal cues and our body language. As the radiologist, Communication is a vital role that should be done for each patient to ensure care is given when needed. Communication between both patients and physicians can result in a smooth, comfortable, and positive process. Something so easy like communication can result in life or death.